therapy session for depression that was seen as outdated and even barbaric is making a comeback. Many of us associate this with electro-convulsive therapy, or ECT. It was used as brutal punishment in the movie One Flew Over the Cuckoo's Nest, but doctors say it's now a painless procedure prescribed for 100,000 Americans a year with severe, hard-to-treat depression. Dr. Sarah Lisanby chairs the Department of Psychiatry and Behavioral Sciences at Duke University Medical Center. Good morning.
Good morning.
First of all, describe this treatment to me, because as we say, everybody has this impression from the movies of what this is, but what is it today?
Well, electroconvulsive therapy, or ECT, today is nothing like what you've seen in the movies. It's a modern medical procedure. It's done under anesthesia, lasts less than about a minute or two, and it's the most effective treatment that we have today for severe depression.
Yeah, many people are still traumatized by what they saw in the movie, because I couldn't get past the fact that you said it's painless. It's painless because we're asleep when it happens.
You're under anesthesia, so you actually don't feel anything, and the movies have been misleading, unfortunately. When you see ECT in real life, it's really anticlimactic. It's nothing like you expect. And from the patient experience, what they experience is a relief from their depression. It's important to know that depression can be very disabling, and it's important to have these effective treatments when medications don't work.
Sarah, how does this actually work? I mean, this electroshock actually resets the brain, doesn't it?
Well, it induces a brief controlled seizure, and that seizure is highly effective. It's more effective than medications. How does it work? Well, as a field, we are focusing on researching that question. We don't
really know, is what you're saying.
We don't have the complete answers, but we have been studying this and learned a lot about the fundamental mechanisms of ECT.
The important thing is it works.
That's the important thing. Depression can kill. ECT can be life-saving.
Yeah, and who benefits? Who benefits from it?
Well, ECT is not for everyone. It's for people who have very severe major depression, who have tried medications and maybe the medications weren't effective or have interfering side effects. So if you've had depression for several months and you're not getting better, you really should ask your doctor about ECT.
Am I a different person afterwards, for instance, if I took it?
What ECT does is it takes away the depression, allowing you to be the person that you were.
What are the risks involved, Sarah?
Well, the most important side effect is memory loss. It can also cause headache or muscle soreness. But in terms of the memory loss, we've advanced significantly as a field. We know how to do the treatment better to reduce that risk.
Is it a cure or just a treatment?
Well, it's the closest thing that we have to a cure today. However, it's not a complete cure. You need to be on a maintenance treatment to prevent relapse after you recover.
So does it mean once you have it once, you have to continue to have the treatments, or do you have the treatments until you are totally better? I'm trying to understand exactly.
You go on some form of maintenance therapy. It can either be medications or continuing with the ECT.
Typically, how long does that last? I mean,
well, we space out
vary?
the treatments to about once a month over, say, a 6-month period.
All right, Dr. Sarah Lisanby, thank you very much.
Thank you.